Hello there. In this video we're going to review some of the anatomical features, mainly the skeletal muscles, that we covered in our practical session on manual muscle testing. Just to give you a even better understanding of where things are in 3 dimensions here. So we'll be using the biodigital software here. So let's begin with this large cluster of muscle tissue here in the, well, what if we were to go into a gym would be considered part of back day, but is in fact a shoulder muscle, very much a shoulder muscle, the trapezius. Now it's important to appreciate that the trapezius, while often described in both the literature and in the more, let's say, fitness world, as I was going to say bro science, but in the fitness world, has 3 separate heads. It does not have 3 separate heads. When we describe the trapezius, so named because it looks like a trapezoid apparently, but I've never quite been able to see that. When we describe the trapezius, we describe its function based on 3 different regions, because each region has a different function. So this being the upper or superior portion of the trapezius, the medial trapezius or middle fibers, and the inferior or ascending trapezius. So if I just remove the trapezius on one side, I've prepared them, get rid of the lat as well. You can see if I've highlighted here on the spine at the base of the skull where the trapezius fibers begin and end. Now the muscle attaches to the occipital bone, then the spinal process of every vertebrae all the way down to the T12 here, the 12th thoracic vertebrae. But it also attaches to the spinal process of the scapula, and if we look around the front here, the clavicle just here. So the upper fibers of the trapezius, sometimes known as the descending fibers rather confusingly, originate on the occipital bone here and are considered to be the fibers between the occipital bone and the 7th cervical vertebrae here. So if we look at that from the side here, that's everything from here. If you were to draw 2 horizontal lines, all the fibers from here to here. Basically, these are the fibers involved in the elevation of the shoulder girdle and the scapula, the shrugging motion. The medial fibers run from, again, the C7 all the way down, and they attach to each of these vertebrae, the T1, T2, down to the T3. So everything between C7 and T3 is considered to be the middle portion of the trapezius, which primarily is considered to be an adductor of the scapula. The lower trapezius fibers, just zoom out for this, run from the T4, I should say, that should be coloured, let's just colour that, my apologies. Not the T3, the T4, confusingly, all the way down to the 12th thoracic vertebrae, so from here to here. So whilst the start and the end and the beginning of the upper and medial fibers overlap, the fibers for the medial and lower trapezius begin and end at separate vertebrae, which makes you wonder what the small band of fibers in the middle, very slim band of fibers here between the vertebrae here are known as, but there we go, we won't question that. So the trapezius, as we know, collectively is involved in various functions for the shoulder girdle overall. It's able to elevate the girdle, specifically the sternoclavicular joint, elevates the scapula as we know it, adducts the scapula, that's the medial fibres, and it's able to tilt the scapula upward rotation of the scapula when we perform shoulder abduction. The lower fibres are responsible for depressing the scapula, pulling down on the scapula. So let's move on. I'll just reset. Okay, our next group of muscles are those focused around the glenohumeral joint. So we touched on the deltoid during the session, so we'll remove that here. And underneath we find the rotator cuff muscles. So this does a fairly good job of illustrating how they got their name, how they all form this white, the tendons of the four muscles form this white collar, which somewhat looks like a cuff, I suppose. Now, I was going through some old notes of mine in preparation for this video, and recalled that one way to remember the rotator cuffs is to describe them as the SIT muscles. Use the SIT muscle acronym. So you have the supraspinatus, S, infraspinatus, I, T, teres minor, and subscapularis underneath, which we'll come to in a minute. So if that helps, then tremendous. So we'll start very quickly then at the top with the subscapularis, the supraspinatus, apologies, this is the most superior, the supraspinatus muscle. So you can see here how this does a really nice job of showing the attachment of this muscle to the medial border of the scapula and inserting its distal attachment on to the greater tubercle of the humerus here, but also how it runs underneath, whoops, still getting used to this software, as you can probably tell, the subacromial space here, and therefore is a candidate for shoulder impingement syndrome. So the supraspinatus is involved in shoulder abduction, particularly the early phases of shoulder abduction, from approximately 10 to 20 degrees of the beginning of the movement. But there is research to show that depending on the position of the glenohumeral joint, the supraspinatus can act as both an internal and an external rotator, confusingly. So there's always a secondary function of a muscle which is confusing. So I won't go into the details of that here, but just be aware that it can act as a rotator in both directions depending on shoulder position. Below this we have the infraspinatus. This is below the spinal process of the scapula here. This, as we know, is a strong external rotator. There's no internal rotation here. You can see from its position how this would be so. The infraspinatus is very much dependent on the strength of the medial fibres of the trapezius and the rhomboids, which I'll just pop back in. There we are. So we have the rhomboid minor and major there, no prizes for guessing which is which. So it's dependent on the trapezius and these rhomboid muscles, it's a pair of rhomboid muscles, to stabilise the scapula during external rotation and prevent any excessive abduction of the scapula, so moving around the side of, protracting the scapula around the side of the rib cage. Okay, underneath the infraspinatus, just find another colour, we have the rather diminutive, but no less important, well, perhaps, teres minor muscle. Now, the teres minor, as we've discussed, plays a supporting role, really, for the infraspinatus. It does everything the infraspinatus does. So it is a external rotator. There's no internal rotation here, and again, it's fairly obvious to see. Both muscles, in fact, have been shown to contribute to shoulder adduction, adduction, and therefore are important for those roles. But the teres minor, I should say, is very much a backup to the infraspinatus, really. It's not as powerful just by its sheer size. By comparison, the teres major, which I know we didn't discuss, which is here, is in fact, I wonder if you can see, if I just remove quickly the pec major, is a internal rotator of the shoulder. So both teres muscles play opposing roles to each other, but the teres major is a much larger and therefore muscle, and therefore able to produce much more force. Now, if you imagine you're opening up a clamshell or an oyster or something like that, and you're peeking under, that's our scapula here, what you would find underneath would be the subscapularis, our fourth and final rotator cuff muscle. And here it is. I've had to remove a few muscles and a few ribs, but here is the subscapularis. Here, so you can see the supraspinatus here in green above. So the subscapularis attaches to what is known as the ventral border of the scapula and inserts slightly just below where the other rotator cuff muscles do, on the lesser tubercle of the humerus. As is perhaps obvious from looking at this image, the subscapularis is a medial rotator, as we discussed, although its function, again, depending on shoulder position, is quite complex. It's been shown to be a strong abductor and adductor, depending on the position that the glenohumeral joint is in. It's also been shown to play an important role in stabilisation of the glenohumeral joint, as all of the rotator cuff muscles do. However, it doesn't play a role in shoulder flexion and extension, which was a long-held belief, but that's not the case. So let's restore our skeleton and move on to our next muscle. So this software does a really nice job of demonstrating how the pectoralis major, which amusingly translates literally into larger chest muscle, so no prizes for guessing what the pectoralis minor means in Latin. The pectoralis major is typically described as a fan-shaped muscle, and that's true for the sternal head of the pec major here, which is the larger portion, but the clavicular head here, the software doesn't treat it as two separate parts, but it very much is, as you can see, it still represents it here, attaches to the clavicle here, and as you can see here, twists around to attach onto the humerus to support shoulder flexion with the upper portion of the chest. So our muscle of interest, though, however, lies below, and it is the pectoralis. Whoa, sorry about that. Still getting used to this software. The pectoralis minor So the pectoralis minor, just zoom in a bit, originates from the third, fourth, and sometimes the fifth rib. And there is some variation there, and inserts all the way back here onto the scapula on the coracoid process here of the scapula. Now, dare I zoom out slightly? There we are. There's been a lot of suggestion about what the pectoralis minor does and the purpose of it, and whether it's even a relevant muscle to human function. And the only significant research that's been found so far is that it is able to cause anterior tilt, so it's forward tilt in this direction of the scapula by pulling on the ribs, which obviously stay fixed, is able to pull the scapula anteriorly and tilt it forwards. Now, that's its movement in isolation. However, it's perhaps best to think of the pectoralis minor, and I think this is perhaps why it's caused confusion in the past to some, as a depressor of the shoulder girdle, because yes, it's able to tilt the scapula anteriorly when it contracts in isolation, but muscles don't work in our body in isolation. They work with a whole host of supporting cast of other muscles, which are there to stabilise or act as a prime mover or whatever the movement may be. And if you were to perform a shrugging movement, for example, if, let's say, you were on crutches that were dug in your armpits and they're a bit too high for you, and you were trying to pull your body down, that would be the role that the pectoralis minor, I should say, would be trying to facilitate in that scenario. So let's move on to our final muscle then and set that one up. So our next muscle is not the left trapezius again. It's this muscle here, which originates from more or less the same region as the subscapularis, i.e. along the medial border of the ventral side of the scapula. And we have to turn it around here on the side to see what we're talking about. It is, of course, the boxer's muscle, the serratus anterior. The muscle then goes on to insert onto either the from 1 down to 8, sometimes 10 ribs. Again, there's some variation there. I'm going to get rid of the humerus there because we don't need it. So the serratus anterior works along with, in some cases, the trapezius, but also as an antagonist muscle in certain movements. So the serratus anterior, I'm going to remove the scapula now so we can see the whole muscle. There it is. Oh, whoops, daisy. Is able to tilt the scapula upwards, so when we perform shoulder abduction it can help facilitate that movement, as the trapezius does, so therefore there is some synergy there between the two muscles. However, whereas the trapezius medial fibres attempt to abduct the, adduct, adduct the scapula, the serratus abducts the scapula, so it tries to pull it round to the front to create shoulder protraction. If you straighten your arm out in front of you, if you perform shoulder flexion but keeping your shoulder back, and then allow your shoulder to round forward to gain a bit more reach, almost if you were punching someone, hence the boxer's muscle, that movement is facilitated by your serratus anterior. It also, I should add, assists with the elevation of the scapula in certain movements. There can be some issues with this muscle. It can be weak, as we've discussed before, this little muscle group, the serratus anterior, and therefore this can cause the scapular winging effect that we sometimes see. You could train the serratus anterior by, the best way to describe it is performing a push-up, so getting in a push-up position, or if you're unable to do that, just getting down on all fours and performing a push-up without bending your elbows is how it was once described to me, which I just couldn't get my head around to begin with, but it's nonetheless true. Just letting your torso sink down just a couple of inches, the range of motion is very short, and then pull yourself back up again. And repeating this movement will engage the serratus anterior. So there we are. That's just a quick whistle-stop tour to give you a greater understanding, a greater 3D overview of some of the muscles that we covered during our practical session for this module, and I hope that's been helpful.